Periodontal disease is prevalent in the population. It can affect all ages. We have teenagers who have periodontal problems. There are some acute periodontal diseases that can affect teenagers, and as we grow, obviously there's more and more opportunity for gingivitis to occur and for gingivitis to advance to periodontitis. The difference being that gingivitis is a disease of the gum tissues, and periodontal disease is a disease of the gum tissues and the bone. It becomes periodontitis when there is evidence of bone loss around the teeth. This affects all ages, and we've had patients even in their middle teens that have had bone loss around their teeth.
Yeah, gum disease is what people call it, right? And we used to call it pyorrhea when we were growing up doing this back in the 70s, because it sounded horrible, right? And the rheas sound like a bad something. Anything with rhea sounds bad, but it's not called periodontal disease. The commercials on TV have now made it look like it's gingivitis and periodontitis. So what periodontitis or gingivitis or gum disease is a bacterial infection of the supporting structures of the teeth. So the gums and the jawbone that hold the teeth in get infected. A combination of the way the bugs attack your body and the way your body responds, and you get this infection that starts in your mouth and has effects in terms of losing your teeth. And what we're finding now, worse than that, is that it also disseminates through your body and has some big effects on how your general health is as well.
Periodontal disease is also associated with other chronic inflammatory diseases such as cardiovascular disease, diabetes, preterm low birth weight, pancreatic cancer, chronic obstructive respiratory disease, and other chronic inflammatory diseases.
Somebody that died a long time ago, about 10 years ago now, and when they did the biopsy of his heart, they found some bacteria that are only present in the mouth. And so investigations started to occur as, do these bugs in the mouth affect the rest of the body? When I was in dental school back in '75, they thought that the mouth isolated all the infections, and then this was the start of the changing of the guard of, no, this infection goes throughout your body.
There is a distinct link between periodontal disease and heart disease. I think most of the research shows today that periodontal disease, being an inflammatory process, can affect the vessels around the heart and the heart itself. Heart disease is also an inflammatory disease.
Not all individuals are susceptible to periodontal disease. That being said, there's about 85% of our population that does have periodontal disease, so it's prevalent within our culture and the United States community. But if you do have bleeding gums and you do know that you have periodontal disease, it's very important that you not only maintain proper home care, brushing and flossing, but also proper professional care, which may involve seeing your dentist or dental hygienist or periodontist every 3 months.